Hi, my name's Bruno Silva. I'm one of the dentists at Brighton Implant Clinic, and we're making this short video as part of a new blog series whereby we'll be doing video content, and the text of this video content will be posted below in the format of a blog. So if you prefer watching the video, it will be posted above, and the reading text can be posted below. And today's topic, we're talking about cost of dental implant treatment specifically. If you're watching this video, it's most likely that you're thinking of having a dental implant. A dental implant is essentially a small titanium screw. It's inserted into the jawbone after a natural tooth is lost, and the procedure is highly predictable, works very well, has a high success rate, and is becoming more and more popular in daily practice. Most dentists today will have some skills and knowledge of dental implants, and some practices, for example, like at the Brighton Implant Clinic, we work almost exclusively with dental implant treatment. If you're considering this treatment and you're looking at the differences in price between practices, you will see that there can be quite a difference in terms of what some clinics charge compared to others. It is important to take into account that the treatment is costly, and ultimately it is an investment in obviously your well-being and making sure that you can restore function or restore your smile. So cost is an important factor, but I stress to patients it's not the most important factor when choosing which clinic or which dentist is going to be providing your treatment. If we discuss and I explain kind of a bit of background in terms of like how costs are actually calculated. Dental implant is a device that's going to be inserted into the body, so the quality and the cost of the actual titanium screw is one of the major parts of the treatment cost. Different brands will charge differently for implants, with some more reputable brands charging higher fees, and this then is the preference of some dentists that prefer working with certain brands that they are more familiar with, that they feel more confident in. And personally, I am very particular about the brands that we use in our practice, and you feel comfortable and confident with those products. It's quite difficult to switch and change when you feel confidence in something that is so technique sensitive and so delicate. It takes years of practice and experience to perfect your skills to fit a particular type of implant or implant brand. So dentists usually will be quite reluctant to move between different brands, different products. Price is just a small part of it. Dentists honestly are mostly concerned about the well-being of their patients, and they will do everything to deliver not only a service but a product that's going to be proven and is going to work well in a patient's mouth. So I think the cost of the implant and the implant components, there's quite a high cost. It is an item which needs to be well tested. It needs to be on the market and scientifically proven to be successful in patients' mouths for it to be available, and the cost of those are quite high. Obviously, the implant itself is just a small screw that's inserted into the bone. You still need to consider the crown or the bridge or the denture that goes on top. And on that note, there are again different products, different prices, and you should try your best to compare like for like if you are comparing prices between practices. So in our practice, we use, for single teeth and small bridges, we work exclusively with zirconia. It is a fantastic product, a fantastic material, which has improved tremendously in the last few years. Zirconia is almost resistant to staining. It's almost impermeable. It's nice and hard. That means that it's not going to wear down like soft materials, for example, like acrylic and composites. And it's very inert and very biocompatible in the mouth. And what we mean by this is that it's the gum tissues find zirconia to be it's a material that's easily cleansable, and plaque doesn't readily stick to that surface, as opposed to, for example, composites or other types of acrylic. They are more permeable and they stain more and they attract more plaque because the small permeations within the material allow things to stick to it, and that in turn causes tissue reactions and tissue responses which are not always ideal. So obviously oral hygiene is very important when having crowns, bridges, dentures, and certain materials like zirconia will make that process easier in terms of keeping clean. But I must stress that within this treatment it's very important that really meticulous oral hygiene is taken care of, because implants, like natural teeth, they need proper maintenance and care. So moving on to the actual restoration that you're going to have on your implant or implants, again there's a varying degree of costs. Some clinics still offering metal crowns with porcelain baked onto that metal. The cost of those can sometimes be higher or lower than zirconia depending on the laboratory and the skill of the dentist and the experience of the dentist, and then ultimately the material of the actual crown or bridge. So those factors basically are kind of the two main costs that need to be taken into account for the cost of implant treatment. And then probably moving on from that, the next costs would be obviously the cost of the dentist, the dental practice, the ongoing costs. Dentistry is a field of medicine, highly technical. Dentists spend a long time. They spend a large amount of money in terms of furthering their education. You can't simply start placing implants and doing this kind of treatment without substantial investment. These courses and ongoing education cost literally thousands of pounds, and again you can't just do a single course or a single module of education to allow you to do this kind of treatment. It's an ongoing life learning process, and dentists invest a lot of money into that, not because they want to charge more, but because they want to understand how to do those procedures prior to carrying those procedures out with patients. So that might involve not only education but mentoring, ongoing support, ongoing days away from the practice where there's lost earnings, to see others do this kind of surgery or treatment, attending congresses, attending conferences, webinars. I mean, the list is endless. But this kind of education, it costs dentists and the team money. And following on from that, the team that supports the dentists, like dental nurses, receptionists, treatment coordinators, dental technicians, again, these are highly skilled, trained staff members which are essential to the success of treatment. Okay, I personally, or any dentist, would not be able to carry out the kind of complex treatment that we do if we didn't have the confidence of the team around us. So that is essential for the success of treatment. The success of treatment depends on a team approach of several individuals. Okay, and those individuals, again, they need extensive training and experience in carrying out those procedures. We also need to take into consideration the cost of compliance, the cost of insurance, the cost of actually making sure that the clinic can actually operate as a dental practice. These costs are hidden costs that dental practices have to comply with and have to cooperate with. I totally agree with those controls and compliances being in place. It makes sure that the treatment and service is carried out in a safe and correct manner. And these costs, together with insurance and indemnity that both dentists and dental nurses and dental technicians need to take, these costs then get passed on to patients, which obviously pay for treatment. So the ongoing increase costs of wages, the ongoing cost of compliance, etc., these all come down to what patients pay for their treatment. We haven't mentioned also just the equipment. I mean, for example, in terms of equipment for your dentist to take a CT scan, to see if you have bone for an implant to be placed. CT scan units start from 50, 60,000 pounds. These units require maintenance, they require checks, they require audits to make sure that they are working correctly on a yearly basis. Dental chairs, dental instruments. In some clinics that have dental laboratories, the machines that are used for making crowns or making bridges, these machines are like milling machines, 3D printers. Many of these machines are in excess of 50, 60, 70,000 pounds. Okay. Dentists are investing in a technology to make the treatment process, to make the treatment pathway more predictable and more pleasant for the patient. And it's a costly field of medicine, it's a costly field of the industry whereby these are precise machines, precise instruments. As I tell my patients, in dentistry, we're not talking in centimeters or millimeters. If you've got a 1 millimeter gap between your front tooth, it's not just a 1 millimeter gap. 1 millimeter gap on a kitchen worktop is maybe acceptable, but not a 1 millimeter gap on a back tooth because the crown doesn't fit correctly. That's unacceptable. So the technology that we need to employ to deliver that kind of precision, it's costly. These are highly involved, highly technical machines that are not available to everyday purchasers. There's not a lot of competition in the market for those kinds of machines. They are selected providers that research and develop machines like that to deliver super precise results. So when thinking of, it's just a tooth, there's an incredible amount of work that goes into making just a single tooth. There's an incredible amount of work that goes into making a denture, because it's not just a piece of plastic, okay? It's not just a crown, it's not just a tooth. It's something that's been custom made and designed and tested and retested many times before, that's going to be fit and suitable for fitting into a patient's mouth and working for hopefully many, many years. So summary of this is, remember, implants are super precise devices that are custom made for you, and think of it as an investment. Think of it that it's something that's going to help you hundreds of times a day to improve your smile or help you to get through your meal, and it is something that can last many years. It needs to be well looked after, it needs to be well taken care of, and dentists who provide implants are they enjoy doing this kind of treatment because it really does work. Yes, there are cases where treatment can fail and your practice will provide details of the predictability of treatment, but overall it's a treatment that works really, really well. So when considering having dental implant treatment, cost is an important part, but it's not the most important part. Think of the practice that's providing it, think of their reputation, think of how long they've been providing this kind of treatment, consider how close to you that practice is. Many patients travel very far distances for dental implant treatment, but maybe forget to take into consideration the cost of trains, the cost of driving, fuel, etc., parking. Those are factors that need to be taken into consideration in all the treatment plan choosing process. My summary really is, cost is just one small part of dental implant treatment decision making, and it's an important part, but you should take into consideration lots of different factors, and I hope that this video will help to explain why implant treatment may cost more than you would normally think. If you do have any questions and you'd like to ask me or any one of my colleagues, as I said, my name is Bruno Silva. I work at the Brighton Implant Clinic. We've been open for 10 years, our main branch in Hove. I myself have been placing implants since 2003, and we'd be delighted to welcome you to the practice. And any questions, just please post some comments below and let us know. All right. You can see also more information on our website. It's www.brightonimplantclinic.co.uk. Thanks very much. Cheers. Bye-bye.